Hi, hello everyone. Welcome back to my channel. Caring for elderly people is a crucial aspect of nursing, requiring a unique blend of medical expertise, compassion, and understanding. As the elderly population grows, nurses play a pivotal role in ensuring that older adults receive holistic care that addresses not just their physical health but also their emotional, social, and psychological well being. This involves managing chronic conditions, preventing falls, providing palliative care, and supporting families, all while respecting the dignity and autonomy of the elderly. Effective communication, patience, and a deep appreciation for the life experience of older adults are essential qualities for nurses in this field. By fostering a safe and supportive environment, nurses can greatly enhance the quality of life for elderly patients, helping them maintain independence and dignity in their later years. I think you people got an idea about whom I am talking about. Yes, elderly patients. Today I am going to discuss about care of elderly patients. Let's get started. A man's life is normally divided into five main stages, namely infancy, childhood, adolescent, adulthood, and old age. In each of these stages, an individual has to find himself in different situations and face different problems. The old age is not without problems. In old age, physical strength deteriorates, mental stability diminishes, money power becomes bleak, coupled with negligency from the younger generation. What do you mean by elder? Elder means the person who has the age above 65 years old and having the functional impairments. Functional impairments means the person is not able to do his day to day activities without help because of functional or physical impairment. The body functions are slowed down. So, here the services which are assisted for him to live or to go this life smoothly, he needs a adult daycare, long term care, nursing homes, like that. So that's the meaning of the elderly care. So now we will see the normal aging. So what is aging? It is not merely the passage of time, it is the manifestation of biological events that occur over a span of time. So it is important to recognize that people age differently. The aging body does change. Some systems slow down while others lose their fine tuning. As a general rule, slight gradual changes are common, and most of these are not problems to the person who experiences them. Sudden and dramatic changes might indicate serious health problems. To know in detail, normal aging has four aspects: biological aspect, psychological aspect, social cultural aspect, sexual aspects of aging. So, we will see one by one in detail. The first aspect is biological aspect of aging. In this, it is unique, different from person to person in the sense of psychological and physical aging process. There will be changes in the cell loss and enzymatic activities, and it occurs at a different rate in different people. So now we will see how this age altered the each system works. The first system which we are going to discuss is nervous system. So there will be changes in the normal function of the system. In the sense, there will be the decrease in the neural conduction speed, there will be decrease in the number of brain cells, memory loss will be there, the patient is not able to remember the recent events, decrease in rapid eye movements will be there, and there will be decrease the cerebral circulation also. So these are everything, the function of the nervous system will be diminished as the aging process will increase. Now we will see the sensory changes. In that, first the main thing is eye. Okay, in the eye there will be changes like iris will be fades. Here you can see in the picture what all the changes are taking. This all will be due to the degenerative process will takes place in the cells of the eye. Okay, so lens become yellow or cloudy, that is called the condition cataract. Okay, opacity of lens. And there will be condition called presbyopia, that is due to the age of the people, they will get the eyesight. Okay, their ability to focus on the close object, decrease the visual acuity. So these are the all the problems will occur in the eye. And next is the sensory organ, that is ear. So there will be decrease in hearing and the decrease in production of the wax from the cerumen gland. Because of that there will be itching in the ear, and there will be degenerative changes will occur in the bones of a ear also. And there is a condition called presbycusis. It is a term used to decrease in hear loss in the elderly people. Okay, so this condition will be increased as the age will increases. Same goes to taste and smell also. There will be decreased ability to taste and smell because of the degeneration of the cells due to the age process. Next system we are going to discuss about is integumentary. So in this there will be changes like decrease in elasticity and decrease the production of natural oil production in the from the skin, and there will be thinning of the skin. There will be decrease of fat tissue under the skin, and they will very sensible to the heat and the cold. Okay, there will be loss of hair color, and the hair also will be thin at the head. I means head region also, pubic, axillary region, everywhere that hair will loss will be there, otherwise thinning of hair will be present. Next we are going to see the system, that is cardiovascular system. Already we know that from the birth time onwards till the older age our heart rate will be decreases. Okay, as the age grows. So newborn baby will have the heart rate 140 to 160. As the older age will have the 50 to 60. So here only you can see the changes how the heart rate is decreasing. That is because of the aging process, degeneration of the cells due to age. Okay, because of this all there will be decreased in physical demand and activity of heart, and there will be slower heart rate and reduce the cardiac output, and contractility also will be decreased, and atherosclerosis will occur due to the plaques and the blood pressure, and there will be ability to respond to stress. Next is respiratory system. Here also as goes. So newborn babies will have the respiratory rate like around 30 to 40, whereas it comes to older age it is 12 to 16 breaths per minute. So because of this all, due to the respiratory muscles weaken or atrophy will occur due to the aging process. So there will be SOB will be there, increased rigidity of the thoracic cage, decrease in gas exchange, diffusing capacity, elastic will be decreases. This all will occur. Next we are going to see the musculoskeletal system. In this there will be decrease in bone density, muscle size and strength, joint cartilage. Because of the increase of parathyroid hormone, there will be decrease in vitamin D absorption, and calcitonin also plays a main role in calcium loss in older people. And in women estrogen deficiency will be there. Because of this there will be malabsorption of calcium. Then lifestyle factors also play an important role, like if we are inadequate intake of calcium and lack of exercise. This all will result in bone loss. Next we are going to see the urinary system. In this, because of the degeneration process, there will be decrease of blood supply to the system, and there will be loss of nephrons. Less blood can be filtered by the kidney, and there will be diluting ability also will be decreased. In female, there will be relaxed perineal muscles. In men, BPH can be seen. Okay, because of this it leads to urinary incontinence, that is dribbling, and weak pelvic muscles causes stress incontinence. Next is gastrointestinal system. In this we can see there will be loss of teeth and is decrease in salivary secretions. Because of this there will be indigestion problem will can occur, and decrease in metabolism. Peristaltic movements also will decrease, and there will be regurgitation can occur because of the weak muscles of the esophagus, and difficulty to chew the food because of loose teeth, and liver weight and size also decreases with age. Next is reproductive system. In reproductive system, there in especially in women, there will be decrease in breast tissue, sexual dysfunction, and decrease the sexual desires. And because of the decrease in vaginal secretion, there will be decrease in elasticity and narrowing of the vagina. And in males, there will be decrease in size of penis and testis. Erectile ability also will change, and it will take longer time for erection, and if it is ejaculate, it will be shortened period, and semen is also will reduced. Till now we have discussed about the biological aspects of aging. Now we will see the psychological aspects of aging. In this, the first thing is memory functioning. Means when about memory, the short-term memory deteriorates with age when comparing with the long-term memory loss. And for this, not that much applicable for the well-educated person and the mentally active person. And the next one is intellectual functioning. So intellectual abilities of the older people do not decline but do some obsolete, and their formal educational experience is reflected in their intelligence performance. Then next is learning ability. The ability to learn is not declined by age, but the reaction will be very slow with the time and with the age. And ability to learn continue throughout the life, although strong influenced by the personal interest and preferences. Then loss and grief. So by the time individuals will reach to 60 to 70 years of age, they have experienced numerous losses, and mourning has become a lifelong process to them. So because the grief is cumulative, this can result in different from person to person, and this can further predispose to depression also. And there will be impossible for the older age people to complete the grief process in response to one loss or before the other loss occurs. And attachment to the others. So the need for attachment is consistent throughout the lifespan. So well-being of senior citizens can be contributed through socialization and companionship. Next is dealing with the death. It is will be more means develop the anxiety in the older people, and there will be pain, and loss may leads to fear or anxiety. Psychiatric disorders next. So in this we can see like dementia, depressive disorders, delirium, sleeping disorders. These are the most common psychiatric illness which will be seen in the elderly people. Next we are going to see the socio-culture aspects of aging. Means it brings many important socially induced changes. Some of those changes have the potential for negative effect on both the physical and mental well-being of older persons. Mainly they want protection from hazards and weariness of everyday tasks, and they want to treat it with respect and dignity, and also want to die with respect and dignity. And retirement is not compulsory in some areas if they want to work continually because they want respect and dignity. So some of the places retirement make the optional. So these are the changes are done in the we can see in the social aspects of aging. And the next we are going to see the sexual aspects of aging. In this first we will see in the female. In the female mostly we will see that most of the women will attend the menopause, and in the what biological aspects we have already learned that what all the changes will takes place in the reproductive system. Because of that the women mostly avoid the sexual intercourse, because it will be like month or it won't be like frequently, because the walls of the vagina will decrease, and there will be normal secretions will be decreased in the vaginal area, so the vagina becomes narrow and dry. There is also decrease in the function of the ovaries because the estrogen levels are decreased in this age. And same as with the males also, there will, because of the aging process, there will be decrease in the production of the testosterones, and as a result this hormonal changes will be there, no, because of that erection takes place very slowly. If it takes also, it won't stand for the longer time, and this sperm production also will decreases, and testes become smaller. Now we will see the factors affecting the aging. Till now we have seen all the aspects of aging. Now we see what are the factors will affect the aging. Mainly there are three factors. First is genetic and environmental factors, then lifestyle, then disease. These are the three factors which will affect the aging. Now we will see one by one in detail. First is genetic and environmental factors. So the genes also play an important role in aging process life. Okay, so whatever the genes they are carrying, okay, from person to person it will be varies, and it depends upon the whatever the genes they are carrying. Okay, depends on that also aging process will be slow or fast in some people. And environmental means the stress which is associated with the exposure of sunlight, okay, that also will trigger the genes aging process. Next is the lifestyle. So the person who is having the healthy lifestyle will have the a slow aging process when comparing with the person is having the bad lifestyle. Example, the like lifestyle which depends upon the smoking, drinking, exercise, adequate rest, then diet, coping with the stress, having a positive outlook. It depends upon all this kind. Next is the diseases. The person who will maintain is or who will following the bad habit lives, they will develop the disease in early stages. So the one who is diagnosed with the disease in early stages, they will have the aging process very quickly comparing with the person who maintain the healthy lifestyle. So depend upon the disease condition also the aging process will be varies. Now we are going to see the theories of aging. There will be two types, biological and non-biological. And non-biological again divided into disengagement, activity, selectivity, continuity theory. We will see in detail one by one. Biological theory means it already we have discussed in earlier. Okay, it depends upon the totally on the physical body, and this will be varies from the species to species and person to person about the aging process. We will see the non-biological theory. In this, the first is disengagement theory. This theory explains that the person who will detach the life from the retirement, like a retirement basis, the work which he is doing before retirement and the after retirement. If there is a disengagement between this, the aging process will be very high. But the researchers are suggesting that it won't be that much response to the aging. And the next is activity theory. This is exactly opposite to the disengagement theory. Here the person will not be retired. He will continue the work after retirement also. So this theory what will explain means if the person will continue like that, he will be active and he will be more satisfied with this life. So the aging process also will be delayed. But it will this is also will differ from person to person, and the circumstances and the environment also plays a role, and it will also show the difference in their activity. Selectivity theory, it will be in between the disengagement and the activity theory, and depends upon the person to person, whatever the aspects they have chosen in their life to continue. So depends upon that the theory will be present, and the aging process also will differ from that. And the last theory is the continuity theory. In this theory means whatever the characters, habits they developed in the earlier stages, earlier stages means like childhood or adolescent, they will continue as much as they can, even though they develop means they are in the old age. Okay, because that doesn't show that differentiate that they become elder persons or they become old, so we have to change the habits. Not like that, they will just continue how much ever they can do. So with that what will happen means, so they will contribute to be a well-being in the later life. So that's the difference in the continuity theory. So now we will discuss about the what are the common health problems they will face in the old age. First, we will discuss about the mental health problems among older adults. Mental health issues in older age people will depend upon the number of multiple factors like social, psychological and biological factors, how they will able to manage the stress, okay, coping factors, okay, depends upon that they will feel like mostly will see the psychological, means mental, these like depression, dementia, okay, these are the common health issues we will see in the older age. And the most one will be the abuse. Okay, abuse, elderly abuse is the general term used to describe certain types of harms which will happen in the older adults. So there are divided into different types like physical, emotional, financial, sexual and neglect. Physical abuse means like hitting, slapping, pushing, okay, these all will come under the physical. Psychological abuse means like shouting, swearing, frightening, blaming them, And financial abuse means by taking of their one's property, money, pension book or other valuables. Sexual abuse means forcing a person to take part in any sexual activities without his or her consent. And neglect means when a person is deprived of food, heat and clothing. This can be may either suffer from only one form or different types of abuses at the same time. So that's about the mental issues. Now we will see the physical health issues. That also we will see according to system. First system we will see cardiovascular system. In this the common health issues are like hypertension, heart disease, heart failure, peripheral vascular diseases, varicose veins and stroke attacks. So what are the nursing interventions you can plan? You can ask the people to be exercise regularly, avoid smoking, eat a low fat and low salt diet, weight has to be in control, BP should be in control, and participate in the stress reduction activities, and regular medications has to be taken if the patient is means older people are on the medication. And the next system is respiratory system. In this common issues we will see like chronic pneumonia, obstructive pulmonary disease, dyspnea, that is SOB, shortness of breath, breathlessness. Okay, what are the nursing interventions here we can take? We'll ask the elder persons to be in deep breathing exercise has to be done regularly, avoid smoking, take lots of fluids and prevent pulmonary infections such as lower respiratory tract infections, and avoid crowds when the person is suffering with cold and flu seasons. Then wash hands frequently. And the next system is nervous system. In this common health issues we can see like Parkinson's disease, Alzheimer's disease, dementia, depression, anxiety, sleeping disturbance. So here what are the nursing interventions we can take? We can advise for hospitalization or encourage the visitors to visit, and teach fall preventive techniques, like they can use the scratches or lightning time, and their room should be at in the floor level only, ground floor, like that. Environmental safety measurements like sufficient light, proper chairs for seating, elevated toilet seats, and then encourage them for the from a resting position, then reduce the risk of falls. And the next system is gastrointestinal system. In this common health issues they may find like problem with speech, chewing because of the loss of teeth, swallowing because of decrease in gag reflex, then constipation, colon gas, fecal impaction, diarrhea, then dysphagia, anorexia. So what are the nursing interventions we can plan here? Means you should ask them to take ice chips, then eat small and frequent meals, eat high, means educate them to take high fiber low fat diet, limit laxatives, and toilet regularly, means you have to educate, means training for the regular toilet, drink lots of water, and food should be served in an attractive way in order to encourage to take food intake. Next system is the urinary system. In this common health issues are like renal insufficiency, urine incontinence, UTI, prostate enlargement, sexual dysfunction. So what are the nursing interventions we can plan here? Means you have to regularly supervise the condition if the patient is developing any one of the health issue, and you have to train the toilet training, then drink you should encourage them to take lots of fluids, and should avoid the bladder irritant products like alcohol, caffeine intake. Then you should practice them to do the regularly like pelvic floor muscle exercise, and maintain perineal hygiene, and should wear clean under clothes. Now we will see the reproductive system. In this common health issues like in females you can see the breast cancer, cervical cancer, and commonly you can see painful intercourse, vaginal bleeding, vaginal itching and irritation. In males, prostate cancer and delayed erection. So in this what are the nursing intervention we can plan? Means you can give the health and sexual counseling and advise about the personal hygiene in this. And next system is musculoskeletal system. In this common health issues we will see like Paget's disease, osteoporosis, osteomalacia, rheumatoid arthritis, spondylosis, stiffness of joints, fractures, everything. So what are the list he has given? So what are the nursing interventions we can plan for this? Means you can encourage them to do the exercise regularly, and they can have to take the eat high calcium diet, limit phosphorus intake, and should prescribe the hormones and calcium supplements. Next is the sense organs problems. So, like visual impairment, hearing impairment, and diminished smell or taste. So, nursing interventions here, you should ask them to wear the glasses. Okay, if they are having the vision problem, so they have to wear the reading glasses. Okay, then they should avoid the night driving and advise for the hearing examination. According to that, they can, if they are having any problems, they can use the hearing aids. So about the smell or taste means you should avoid them to have the spicy foods because they doesn't taste it. Okay, so like that interventions you can plan for them. Next system is integumentary system. So the health issues they will face is here, the list is given below. Okay, so what are the nursing interventions we can plan means avoid solar exposure and dressing should be appropriate according to the temperature. Then maintain a safe indoor temperature, and the bath water also should be not that much too high heat. Okay, they should be avoid the excessive use of soap and apply creams like to lubricate the skin. Now we will discuss the last point in this session, that is health promotion in elderly. In order to maintain a healthy lifestyle and to prevent the disease conditions or restore the health whatever it is there as the age process is increasing, means you have to follow some points or you have to include in your lifestyle, that is exercise and activity, nutrition and diet, stress management and self-care and responsibility and community services. Now we will see this each thing 1.1 in briefly. Okay, so what is about exercise and activity means they have to do some sort of exercise in their lifestyle, even though it is a 10 to 15 minutes, that has to be continue in their day-to-day activity. Okay, so in order to balance their life. Okay, and the next is nutrition and diet. They have to keep this diet in simple, and they should avoid that spicy or this one what fat rich diet, everything which is not easily digestible for their age according to. So they have to be take the simple diet. Stress management, they have to be do some sort of yoga, exercise, meditation in order to manage the stress. And the next is the self-care and the responsibility, that they have to be monitor their BP and blood sugars regularly. Okay, then diet control and balanced diet has to be maintained, and they have to stop the alcohol consumption and smoking. Okay, advice to take proper rest and sleep, exercise, that this all will come under the like self-care and responsibility, which we have already discussed in this video previously. Then community services, there are some community services will also available in order to maintain the health, like there will be group counseling centers will be there, adult daycare center will be there, rehabilitation, hospice care or ambulatory care services, in order if the elder patients are already having the problems, to in order to maintain it or in order to prevent the worst of becoming that. So they have to maintain this all those things. So with this we came to end of this video. If you have any doubts and everything, I used to tell that just pin me in the comment section. I will clarify you. Until then, take care. Bye. We will meet in the next video.